This is the Real Change Wilmington podcast, episode 20, Inside Brightview, with our guests today, Paula Harvey and Michele Ricketts.
It will be huge if we could get everybody to really work together and not this person says we should do this way or this person. If we just really collaborate, I think that we can make a difference.
What is going on, everybody? This is your host of the Real Change Wilmington podcast, Dustin Pierce.
And I'm the co-host, Emily Spencer.
I swear to you guys, she is very enthusiastic right before she has to say that, and then she gets into this monotone thing. Can you say it again, Emily, with some enthusiasm?
And I'm the co-host, Emily Spencer.
Yes, that's who she really is. I don't know why she has to fake that she's like this detached human being.
Just gotta let them know that they can't hate me more than I hate me. So.
Wow, yikes. All right, so we have a great episode for you guys today. We finally got to talk to Brightview, which is awesome. It's the first time we've talked to a guest who is addressing the issue of addiction in our community. So very exciting stuff. Emily, what are some highlights from this episode for you?
I really liked when they spoke about it's not just about Brightview or just about Tower House or just about solutions. Michele talked a lot about how she wants to work with all of them together, because at the end of the day, they're all fighting towards the same goal, which is to reduce addiction in this county.
Yeah, and to bounce off that, something that stood out to me was just how personal this issue was for both of them, how it's affected their lives, and how they're just trying to break the stigma in our community to help people who are suffering from addiction. So before we get into the episode, like always, the hot goss in our lives. Emily, what's new with you?
I recently joined a group on Facebook that shares Amazon codes for like big discounts off of things. So I bought myself a new knife set because I had trash garbage knives from Walmart.
So how much were they?
They were originally like $90, I think, and I got them for less than $20.
And what are they? What's special about them?
They're like a Japanese stainless steel, I think. They're just really nice. They're really pretty. They look like there's like a design on the blade that looks like the rings of the inside of a tree, and it has the name of them on the end of the handle. Haven't used them yet, so I'll give you my review on that later.
Yeah, Emily was saying yesterday how she's reading a book about a person who's been kidnapped, and I was like, "Oh, are you gonna learn how to kidnap somebody?" And she said, "Yeah, I'm gonna put your name on these knives and then blame you for kidnapping somebody." And I was like, "Wow, you're a psychopath, Emily."
Can't take the fall for my own crimes.
I'll give people an update on my chickens. So I got some new chickens recently. They're teenagers now, I guess, so they're living with my other chickens. And I gave some away because I had too many chickens in my backyard legally. And Vance was going to come to my house soon and arrest me because I had too many chickens.
The crime, too many chickens.
Too many chickens. So I had to get rid of some, and I got rid of 2 of the 3 Americana chickens that I had. So I just have 1 left, and it's the only one that I have. So I think the other chickens are abusing it now. Whenever I put it out with the other chickens, they all gang up on it and pull its feathers out. It's really quite sad. So I have to section off an area of my coop and every morning put that one in there. Every night put it in the sleeping area, I guess.
They're gonna make it sleep at the front of the coop.
It sleeps fine, but it looks like the owl from Harry Potter. So
Hedwig?
Yeah, so I named it Henwick. Get it?
So now you've got Silky Chicken.
Silky Chicken, yeah. It's an
pumpkin.
idiot. Yep. It's like a pumpkin, yeah.
And Henwick.
And Henwick, yeah. Anyways, with that nonsense out of the way, let's get into the podcast. Should I say Michele and Paula, or Paula and Michele?
Whatever you want to do.
All right, welcome to the podcast. Ladies. Yeah. All right, so we're going to start by just having you guys tell us about who you are and how you got your role in Wilmington here at Brightview. So, Paula, how about you go first?
Well, my name is Paula. I've been operations director here at the Brightview Wilmington location for a little over 2 years now. I lived in California for probably about 16 years or so, and then I moved back to be closer to my parents. And this job opportunity came along, and I've always had a passion in the field because my sister suffered from addiction and overdosed, and I had a best friend that passed away from an overdose. So it's near and dear to my heart, so I knew it was the right role to go into, and have been working there ever since and loving it.
Okay. Michele, how did you end up here?
How did I end up here? So I actually come from the healthcare world. I used to do home care and hospice. And I had a friend that worked for Brightview for, I think she was here like probably 3 years at that point. Came to me knowing that I have a family history of addiction. My son was in addiction and is now in recovery. He's with 2 children and doing well. Back then, I knew her as well, and I knew that there wasn't a lot to help my son back then. And this position came open, and I said, I think this is where I need to be. So here I am, the outreach director for Wilmington.
Yeah, so let's get into you guys' roles in your day-to-day. So Paul, what is your role and what does your day-to-day look like?
So I just handle all the operations for the site. So just making sure that everything is running smoothly, taking care of all of my employees and getting to know all of my patients, making sure that our patients are having the very best experiences and that they have all the services that they need and that they're doing well with their counselors and they have all of the interventions and everything that they need as well.
Okay. And then Michele, what's your role look like?
So I'm in outreach. My job is to educate on substance use and alcohol use and how we can serve the community at Brightview. I work with local first responders. I work with the homeless shelter. I work with the hospitals, and I do outreach like this just to get awareness out and help people get to where they need for treatment.
Okay. So who would be the best person to talk to about the history of Brightview and how it got started in Wilmington?
So Brightview has been in Wilmington we are a little over 3 years now. They started out about 7 years ago in a little center in Cincinnati. Started with a doctor, a lawyer, and a businessman. I know it's like a cliche, but
it's a joke.
A doctor, a lawyer.
So what's the joke? Yeah.
Facility.
They had a passion for addiction and they decided to start their business there. So they started in Cincinnati and then it just, with a passion for the harm reduction model and addiction, and it just rapidly grew from there with expansion all throughout Ohio. And now we're in multiple other states as well. Then was about, I can't remember the exact number. I want to say it was maybe the 21st site, I believe it was.
Okay.
A little over 3 years ago.
Okay.
We have over 32 in the state of Ohio locations for Brightview right now.
Yes.
And you mentioned, Michele, before we started recording that Brightview is for-profit,
Yes.
and there's some controversy around that. So what's the benefits of having it for-profit, or why is it a for-profit for? I don't know or care. I just was curious of what the issue is, I guess.
So as a for-profit,
Paul's answer. Okay. Yeah.
it does give us a little bit more of an opportunity to be able to have more resources to be able to help in the community because we're not solely one particular grant or anything like that.
Mm-hmm.
So we have the opportunities to be able to reach out and partner with multiple other resources. We also have our own organizations within the company that help with financial aid programs. We have an inpatient program that they have done in Cincinnati, which is like a sober living. So it does give us the opportunity to be able to do a little bit more.
You said Brightview has inpatient in Cincinnati?
Well, it's a sober living.
Oh, so okay.
Yeah.
Gotcha.
But we have several inpatient facilities that we partner with. So.
Okay. Very cool. So give us an overview of the services that you offer. We'll get into it more later on, but just like a brief overview of what you do for people.
So we do intensive outpatient treatment, outpatient. We do medication-assisted treatment, which some patients do medication-assisted treatment and some don't. We have one-on-one counseling for them, and we do group sessions for them as well. But like I was telling you, we also have our own pharmacy, so we are able to provide medications on site when they come in as well. We are open Monday through Friday from 8 in the morning till 5, and we're able to take walk-ins at all times. They can set an appointment, or they don't have to set it. So a lot of times, like I was telling you, I work with some of the first responders. So if somebody called and said, look, we have a potential person here needing help, they can send them right into us without waiting.
Okay.
And they'll see the provider that day and start services that day.
So when a first responder interacts with a person, I'm assuming if they're on drugs or something, that's a criminal thing, or?
Yeah, like if they've been called out with someone that's actively in substance use or actively with something with alcohol, instead of taking them to jail, they decide, hey, this person really needs some help. We want to help them out, and we can send them straight to Brightview.
Okay. Do they still get charged then at that point, or how does that?
I don't.
You don't know. Okay. I'm just curious. Yeah, just digging in.
I don't know about that part. I know they're working on things with that.
Yeah.
They're really trying to reach out and help the community, and we're trying to help work with them as well to get people help, because that's really what is needed other than jail.
Yeah, for sure.
So.
And we are constantly reevaluating the needs of the community. For example, recently we realized that there was no anger management classes being offered within the community anywhere in Wilmington. And that was a need for a lot of our CPS cases and such.
What does CPS mean?
Child Protective Services.
Okay. Everyone looked at me like they knew what it was but me. I'm so sorry.
So we started some anger management classes so that we could do that for the community as well. So
We really try to cater to the needs of patients in each individual community. So we kind of look at what Wilmington needs and try to find anything and everything we can possible to make that happen for them.
And as a for-profit, going back to that, you guys can make those moves faster than, I guess, right? Or you don't need to get a grant for a certain thing. You
Correct.
just say, this is the need, let's address it.
Correct.
absolutely.
Cool. Next question. So can you describe the demographics of the people that you serve?
I would say probably a large majority of our patients are of the Medicaid population. We have a lot of unemployed and impoverished homeless patients, low income. They're definitely the people who definitely need the most help.
Do those situations, I guess, tend to make people have addictions more, or what's the correlation between the two, I guess?
Unfortunately, yes, because a lot of the times those people are homeless and they're in not so good situations, so it does tend to correlate a lot more. However, we do have patients that are, addiction doesn't discriminate, so we have patients of all different walks and races and everything else. So
Okay.
Most of the time, I mean, mental health and addiction correlate together.
Yes.
They go hand in hand most of the time. So, we work with people on helping with the mental health piece as well as the addiction piece. We have case managers that once they get into recovery and they're working their program, then we work on helping them get housing. We work on helping them get food and jobs. And if they don't have those first initial components taken care of, they can't take care of the rest of their life. So we really work on that whole person and the disease. And so that way, once they get into recovery and they're no longer using substance or alcohol, they have a mindset to where they can actually, start looking for jobs and start looking for housing. And that's kind of how we help as well, because our case manager works with them as well.
Yeah, I was going to ask if you also do mental health. So what does that's
Dual diagnosed.
Okay.
Most people in addiction have some form of mental health, whether it be anxiety, depression, clear up to your schizophrenia and bipolar. So we treat the whole person.
Okay. Very cool. So what are the different types of addictions people in our community are dealing with? What's the range of conditions, I guess? You kind of touched on a bit, but...
Like as far as what types of drugs or...
No, I don't need to know the types of drugs.
I'm sorry.
I'm going to make a list of drugs. I mean, is it just like drug and alcohol? Is that the spectrum then of addiction?
for the most part, you have the stimulant disorders, which is a really big issue here in Wilmington. I think that's our biggest, is the stimulants with the methamphetamines, and then of course the opiates, and then alcohol.
Okay. So you guys mostly offer outpatient treatment. When would you decide someone needs inpatient and you need to partner with one of your organizations to get them that kind of treatment?
So when the patient comes in for their initial day one induction, they would do a medical and a clinical assessment. So they'll see a medical provider, they'll see a nurse, and then they'll see a counselor as well for a clinical assessment. And out of those assessments, we would determine what level of care is needed. So if we determine that the medical provider and the counselor determine that they need a higher level of care, then we would immediately start working with our case manager to find them a placement through whoever would accept their insurance or best placement that we could find for them. And then we would just follow up with them after they are released from inpatient.
Okay.
And then sometimes they can either, if they outside of that, they can either be outpatient or intensive outpatient.
What's intensive outpatient mean?
Intensive outpatient is just the next step above outpatient treatment. So they just do a little bit more. So usually they'll do 9 hours of clinical services per week. So between usually 3 groups and their counseling sessions per week, along with seeing the doctor and their MAT if they're doing medication.
It's increased visits as opposed to somebody just doing regular outpatient. It's just more intense. So the number of times they're coming in is increased.
Okay. Go ahead, sorry.
You had talked about in Cincinnati they have sober living. Is that just certain Brightview locations, or is that something that could possibly come to Wilmington's?
Right now they just have the one sober living with Brightview that's in Cincinnati, but we do partner with other sober livings within the area. So if the patient is not able to go there, we want to do what's best for the patient. So we always work with them on their needs and where they want to be. So
Yeah, my next question is less about Brightview, more about just Wilmington specifically. There's a lot of like people saying that we don't have an inpatient facility, we need one.
Oh, absolutely.
So you guys think we do need one?
Yeah.
Okay. What would it take? So it's not a Brightview question, like what would Brightview do, but like what would it take for our community to be able to get a inpatient facility? Is it a company like yours that needs to do something, or like our community to pay some money? Like what does that look like?
A nonprofit could probably do that. I mean, there is grant money out there. I mean, there's a lot of grant money out there for different things, and I think that it would be very valuable for us to have that here. Whether it was a Brightview thing or another company, doesn't really matter. I mean, I work for Brightview, but I also want to help anybody and everybody I possibly can, and I see a lot of need for sober livings. I see a big need for inpatient as well, and I think it would benefit us tremendously.
Do you think it's possible, like that our company could get our community could get a grant or something for something like that? I think
it's possible.
Okay.
I definitely, and from even just the short time I've been with Brightview, like the conversations I had originally when I first started as compared to now, the mindset for our community is to really help. I think the right people are coming into play to make some changes, and I think that over time, I think it's definitely possible for that to happen here.
Absolutely, and the need is definitely there for sure.
Okay. So are there stories you can share, not specific details, people's names and stuff, but people recovering from addiction and transitioning back into a regular life?
Oh yeah, we have success stories of patients every day that are doing well in their recovery. Every day we have patients who are, I had patients that could be in treatment for a little over a year, and some people that are in treatment for even longer. I had one patient that was in treatment for a little close to 3 years, and then he just had weaned himself off of the MAT and was doing really, really well. He, went back to found a really great job, was able to buy a house, got married, had a family, did really, really well, and was able to successfully go back into the community. And we get those kind of stories every day, and that's what makes it worth it. So
nice. Are there, on the other side of things, are there stories of like communities or cities that have successfully are successfully tackling the issue of addiction, like case studies maybe of cities? Does that make sense? It's a weird question, but like, is it epidemic nationwide? Like, are there certain cities that have like done things to help the issue that you know of?
So I grew up in West Virginia, where the opioid epidemic started, and I know that unfortunately there's not a lot of treatment facilities in West Virginia because a lot of the Medicaid and stuff doesn't pay for treatment back there. So a lot of the nonprofit organizations and churches, local churches and stuff back there in the smaller towns, created their own nonprofits and then they started to bring on like volunteer doctors and treatment providers and counselors that they were partnering with different, people within the community and stuff to be able to help those people. And it has been pretty successful.
So do you think maybe just having more community involvement in different levels
Absolutely.
is what helps?
I think we need to work together a little better.
Yeah.
I think instead of looking at each other like we're all competitors, we really need to look at it more as we're all in this together.
Exactly.
The people that do need help need us to meet them where they're at, and that's what we try to do at Brightview, but we're also trying to do that and to collaborate with others in the community. So, other SUD providers, mental health providers. I work really closely with the homeless shelters as well, but I think the mindset needs to be that we are one community and we all need to help together.
Absolutely.
And it's not going to take one or two of us. It's going to take an army of us, but I think it's possible to make good change here. I just think there needs to be some patience and understanding, and there's such a what's the word I'm looking for? The way people look at people in substance use and alcohol use.
Stigma, maybe?
The stigma.
Okay, yeah.
The stigma has to be broken,
Right.
It truly is a disease, and these people have this disease and they need help, and there is help here if we just work together. I think we would see a better success rate overall, with the addiction, with the homelessness. I just think that the mindset needs to change a little bit more, but I think it's starting to.
Yes.
And I think, if it continues down that path, I think there'll be a lot of changes for the good. That's my opinion.
Yeah. When you say disease, I heard someone say recently that like maybe at a certain point it's a choice, but then after that it's like your brain changes and like, you know what I'm saying? Is that how you view it, how do you view it?
I think a lot of it stems from childhood and trauma from our past. And if you have that that addiction or that disease from way back when, and it gets triggered, yes, maybe that first time might have been a decision to try something, or maybe it was accidentally trying something, and it triggers that. That's, I mean, from studies and reading and just the knowledge that I've gained over the time, I think, but it, your brain hits that one time, and then it's seeking it nonstop, and you're not going to get that same high every time. So it's definitely a disease that holds on to your brain, and it's rough. I mean, that's the biggest step anybody can make, is walking to the doors and asking for help, because it takes a lot, and they don't always. There's multiple times, they come in, they do well, and then they backslide, and it's a process. But the more support we give them, and the more resources we have for people that are actually asking for help.
And it is something they struggle with for the rest of their lives too. It's not something that just goes away.
It's like, I relate it to diabetes. If you're diabetic and you have to take insulin, it might be something you have to take for the rest of your life. You can manage it. Sometimes you can manage it with food and how you eat and exercise, but it's there forever, and you have to consistently be taken care of. And it's the same thing, I think, with addiction.
I would imagine that there's certain life situations that bring people back into they're doing good. Maybe they have a job, they got housing, but then they lose their housing, they get divorced, and then it just goes right back into addiction again.
And we try to, there's people that have to do this forever because they do need someone to talk to, even if it's once a month coming to counseling and just getting that training that it's a mind. You're training your mind. I mean, really how to live in a different way, and some people it's forever.
And that is the biggest and the most important thing in treatment, is learning those skills. Medication is important, yes, that's an important piece as well, but the most important thing that they can take with them is the education, the coping skills that they're learning, the things that they're going to take with them going forward, so that when they get put into those situations and have those triggers, they know how to handle that situation, and they know how to train their brain to think in a different way and to move away from that.
Yeah. So I don't know the ins and outs of what happened in West Virginia, but it seems like there's not outside help. They're just people trying to take ownership and help the issue. What can the average citizen do to help maybe be educated about the issue and also do something about it?
I think education is definitely a big piece, just making sure that everyone is educated so that we can continue to break that stigma of the way that people see addiction and the way that people treat. We have a lot of patients that come in just to come in because they feel it's their safe place, because they just feel like they're just treated so badly everywhere else, and they're just judged everywhere that they go. And they just want to go somewhere where they can feel like they're an actual human, and so definitely need to educate people, break that stigma in any way that we possibly can. And then everybody just talking, advocating, working together to try to come up with plans to continue to help as many people as we can.
I really think this community just working together, it will be huge if we could get everybody to really work together, and not this person says we should do this way or this person. If we just really collaborate, I think that we can make a difference.
Yeah, but where do we come together to make that collaboration though? Are you saying police and judges and then all the other people? How can the average citizen get involved, I guess, as opposed to just having an opinion?
If you see somebody that you see is struggling with mental health, or if you see somebody struggling with alcohol or substances, instead of just walking by and laughing or whatever we do, let's be real honest.
People laugh.
People laugh. People
okay.
say things. It's instead of doing that, say, hey, I know there's a treatment center on this street down the, let's make a call for you, or, hey, I have a person's number here. Let's call them and help. Giving them a card to someone's business, to, Solutions or Talbot or Brightview or wherever, giving them information just so that they know there is help out there. Showing them down the street, there's this place down here that can help you. Just offering a kind word, asking a question, how can I help? Sometimes just the littlest of notion can help somebody.
Are there people who don't know that you exist?
I think so.
I'm sure there is. I'm just asking.
I'm sure there are.
Yeah. So educating people who need the help, that there is help available.
I think if they just knew there was one person they could trust or that was listening, I think that can make a difference.
Do you think because this is an epidemic, nationwide, worldwide, addiction crisis, do you think that because it's becoming something that's touching people that never expected to be, I guess, touched by addiction, so it's happening to our friends, our children,
Absolutely.
our families, and people are more receptive to learning more about addiction and how.
I think that's when they become more receptive. I think that's when when it hits somebody personally in some capacity, that's usually when ears and eyes start opening. So unfortunately, sometimes it takes that.
We're going to get into the concerns and misconceptions, so I'm going to try to word these constructively. There is a perception in our community that there's a lot of crime, a lot of petty crime, and some of that crime is fueled by people who have addictions. I'm not sure if that's true or not, but that's what I hear. Is our court system adequate to help them? And what I mean is like mandated treatment and things like that. Does that work?
Yes, I think that they've come a long way with our court system with helping. We have drug court.
Talk about drug court for a bit. Like what is that?
So it's a group of, there's a treatment team that works with the judge and the probation officers, and they give people an opportunity to go in and get into recovery and do treatment. And I believe in lieu of doing that, it can get rid of some of their charges. It's been a very successful year. I think it's an 18-month program for them. I'm on the treatment team, so I work with some of our patients with that, and I've seen huge progress. People getting out of the substance use, getting jobs, and getting their families back, getting their children's. You're talking about stories. I can't talk about clients, but I've seen one of our patients now have their back in their lives of their children, and just the amazing stories that you see and hear because of it. I think there's other programs that we could use down the line that I think are coming. I think that law enforcement and first responders is like paramedics, and I think they're all willing to help. And yeah, I think it's getting better here for sure.
You said drug court, but isn't it branded something like
U-turn court?
Is that what it's called?
Yeah.
So drug court is U-turn.
It's
okay.
awesome. Yeah.
Is that just for youth or is it for anybody?
It's for adults.
Just adults?
I believe it's 18 and older, yeah.
Okay. Yeah. Nice.
Hopefully I'm talking correctly on that.
So with recovery, and kind of back to what you were talking about, court mandated recovery versus self-sought out recovery, goodness. Do you find there's a bigger success rate with either side or success in both?
I've seen success in both. I think it just depends on the person. The person has to be ready. If that person is ready, then they will, and they're willing to do what they need to do, then they will, be successful in their treatment. I've seen people, who are court mandated, even though they are mandated by the courts, they're just not ready and they don't want to. So they try to do, everything they can to get out of it and not be successful. And then, vice versa, people who start on their own and then like, nope, I'm not ready for this. It just depends on the person. But I've seen major success in both sides.
And I think most of the people that are in U-turn court have asked to be part of that program. That one's not necessarily
it's not mandated, yeah.
Correct. They've asked to be in that program. So if they're asking, they're probably ready. I mean, not, it doesn't always go perfectly, but they are very successful in it.
Are they asking because like it's either get treatment or go to jail or like get fines, or do they actually
I don't know exactly how it works. I didn't get into it initially. I don't want to speak on that.
Yeah.
I can just tell you that the people that I have seen in there are doing very well, and Judge Ehrlich does very well with those people.
Yeah.
I've seen great things come out of there for sure.
Nice. Next question is, I've attended a few council meetings in the past where a citizen or two will talk about needles in the community. So how can our community, or what should someone do if they find a needle, and how can our community maybe address this problem, if it is a problem? Just because one or two people talk about it means it's actually a problem,
I don't know. Like, I don't know what I don't think there's really anything in place yet here in Clinton County. I've had several discussions with people saying there might be a need for a program like there is in other counties. We don't have any currently. I think if someone came across needles, I would think possibly going to the health department might be a safe place to go, or maybe even the hospitals. But I know that other counties have like syringe exchange programs in place. They're trying to prevent obviously bloodborne pathogen diseases and so forth. We don't have that in Clinton County right now. Maybe at some point that might be a need, but
What does that
different
program
opinions
look
on
like?
that.
Yeah, sure there is.
Different opinions on that. There's different programs that can do that. I mean, it obviously plays into harm reduction, which we're very much pro harm reduction, but we have a lot of work to do in this county to get there probably. But
What is a needle exchange program? What does that mean?
That's where they can turn in their dirty needles, their used needles, and they will give them clean needles with the understanding that they're, trying to prevent HIV, hepatitis, and those kind of things like that. So, harm reduction.
it's kind of a touchy subject.
Yeah, I'm sure it can be seen as like maybe enabling, but like who wants to touch a needle and get like a disease? Like that would suck too.
Here since we don't have a program like that, if anybody, comes across that, if you are going to touch something like that, make sure to do it with gloves and that you're protecting yourself. And then you could probably take it to any health department or, any other substance abuse treatment facilities and can be disposed of in a safe manner.
Both of you have said harm reduction model. What is that and what does it look like?
We obviously want everyone to be in recovery and not using, but we also have to look at saving lives, and harm reduction is saving lives. We want to prevent them from getting, like she said, blood pathogen diseases. We don't want them to be overdosing. So, making sure that Narcan's out there and that they have that available to them. There's fentanyl strips now for people to make sure they're not getting, fentanyl's being put in a lot of the drugs now, and a lot of people don't even know they're having it and they're overdosing and dying. Same with the newer tranq drugs coming out. We just, we want to save people's lives in any capacity, and harm reduction is part of that. Until they're ready, we need to give them means of staying alive.
Yeah, it's basically just meeting the patient where they're at and doing everything that we can to keep them safe.
Last question.
Uh-oh.
It's not a doozy. It's a good question.
Gotta give you a hard time a little bit.
All right, sure. So as you work with people and communities dealing with addiction, what gives you hope that things can get better?
I have personal experience with my son from where he used to be to where he is now, and that's without anything really available back then. To see the progress in addiction services and treatment centers and inpatient, outpatient, the mindset's changing from back then. And the people I've personally helped in my job, I've had families come to me days later thanking me for just giving the opportunity or just giving them even information. A lot of my job is just giving the information. I don't always walk somebody's from door to door to get them into treatment, but I've been able to give them the education to get help when they're ready or to help a family member. I've helped anywhere, I've helped our firemen and police with people they've known, or whether it's personal or not, or business. And, I've had a sister from another town call me in complete despair because her sister was in the hospital in another town and they did nothing. And we got her into treatment, by channeling and helping. And there's a lot of hope out there for these people. And I'm glad to be part of it. And I'm going to do everything I can to help. And I know we do at our site, and lots of us out there that are willing to do what we need to do.
Yeah.
Did that answer that?
It's your question. Yeah.
Definitely seeing the progress. It's very encouraging to see the progress that just in the 2 years that I've been here, I've seen progress within the community with the mindsets and the officials within the community that, prior would never work with us and now are doing, working very closely with us. And just seeing the success stories of the patients every day, it's very encouraging.
I think people truly want to help. It's just not everybody knows how to help. Like you asked that question earlier, and the fact that people are starting to ask how is even more hopeful than 10 years ago, 5 years ago, even.
Yeah. If people wanted to get in touch with you to learn more or maybe get involved, who would be the person to talk to about that?
Me, Michele.
And they could call or email you?
Call or email, doesn't matter.
Okay.
And my email is m.ricketts@brightviewhealth.com.
Very cool. Well, thanks guys for doing the podcast. I really appreciate it.
Thanks for having me.
Thank you for having us.
Well, that is it for today's episode, everybody. I hope you learned a bit about Brightview and about the issue of addiction in our community. So if you have any more questions, feel free to reach out to Michele with her contact information that she gave, or just, walk into Brightview down the street on Main? It's on Main
Yeah,
Street.
it's almost me.
Yep. And just walk in and, maybe you can get a tour or talk to somebody about what they do, how you can get involved, how you can get educated, and help our community to address this issue of addiction. Anything you want to add, Emily?
Just the usuals. If you're not following us, we do have social media. We are on Facebook and Instagram at Real Change Wilmington. And we're also on YouTube with our 26 subscribers. We've gained one.
All right. So with that, I'm Dustin Pierce.
And I'm Emily Spencer.
Keep it real, Wilmington.